that it is said that a healthy spine and a healthy body can open up a million opportunities for us away from stress, exhaustion, tiredness, and pain. Why don't we try and open up these possibilities in our life with a dorsal stretch, um, which also opens up the Sushumna Nadi, thereby increasing the pranic flow in the entire body and thereby also keeping us healthy. This asana also has gives us a feeling of surrender, thereby reducing ego. I am sure, my dear friends, that you're already trying to guess which asana it is. Yes, this asana is not about touching the toes, but rather it is about learning as we go down. Dear friends, let us learn Pashchimtanasana today. Now, I'm sorry, Pashchimtanasana is mentioned is a classic yogic pose, and it is mentioned in the Hatha Pradipika and also has been mentioned in Siva Samhita. The name Pashchimtanasana comes from the Sanskrit word Paschima, which means back. And now there's a trivia for that. When we do these sun salutations, we're actually facing the sun in the morning, facing the east. So this becomes the back, becomes like the west. And then Tana is to stretch, and I don't have to tell you asana. Asana, all of you know, is psychosomatic posture. So that makes it Paschimtanasana. It is also called the posterior stretch pose, which is done in a seated position, right? And where the upper part of the body is folded over the legs. This gives a very beautiful dorsal stretch to the body. Okay. So friends, why don't we understand what are the benefits of doing what are the impact on the anatomy and physiology of our body with the help of this chart? Why don't we start with the muscular system first? Now, in the muscular system, you see the back, the dorsal part of the body is made up of a network of muscles and fascia. Fascia as in the fibrous tissues. Now, with this asana, there is a stretch that is felt from the plantar fascia in the foot to the scalp fascia in the head. The stretches are felt in the waist, the glutes, the calf muscles, behind the knees, the hamstring, and this improves the blood circulation in this area. Coming to the skeletal system, of course, the joints of the hip, the knees, and the ankles are engaged, making them strong and sturdy. Let's focus on the vertebra on the spinal column. The spinal column, we know the vertebra is articulated one over the other with IVD, the intervertebral disc in between, and are put together, held together by the ligaments. Now, and that is then covered or held together by the skeletal muscles, which keeps our body structure in order. So with this asana, there is a complete stretch that is felt in the muscles around this area. Also, the ligaments get a good stretch. Coming to the circulatory system, as I already mentioned, there will be fresh flow of blood in this area of the spinal column behind, and also in the stretches felt in the hamstring and calf muscles, etc. Now, when you look at the charts, when you look at the here charts in the bottom, you will see that even the anterior portion, the heart gets a massage, the abdomen and the pelvic organs, they all get a massage. So the heart, the kidney, the stomach, the intestines, even the reproductive organs, all of them get a good positive pressure in the massage. Now, these were the local effects of the asana. Coming to the associated effects, come to the digestive system because it's connected there. So with the positive pressure that is created here, that with the the functioning of these organs in this area improves significantly. Now, coming to the nervous system, very important. We saw the vertebral column, and that protects the spinal cord. We all know that. And what is a spinal cord? A spinal cord is a column of nerves, yeah, that connects the brain with the rest of the body, the muscles, the organs, etc. That kind of controls the way we move, the movements that we have in our body, right? And very importantly, from between the vertebrae, when you see the stretch that happens, there comes the nerve fibers. The nerve fibers are activated, and or activated in the sense they are able to function much better because of this asana. And finally, to the reproductive system, the gonad glands especially are able to absorb the nutrients, much required nutrients in the nutrients from the fresh flow of blood, thereby increasing the vitality in both men and women. Now, having understood this, why don't we have a look at how the chart, look at the chart where to understand how this asana is performed. So from the initial relaxation position, the sadhak is seated here with his legs apart, hands behind rested, his neck is rested behind, eyes are closed. From that position, he would then open his eyes, straighten his neck, bring both the legs together, first the right then the left, bring both the hands by the side of the body, right and left, and then he will ensure that his respectively the toes, the ankles, the knees are all together as in one unit. He will place both the palms on his thighs, fingers pointing to the toes, and now his elbows are close to the body, his spine natural curvature, shoulders bit back, his chin is parallel to the ground currently, and as a next step, he would look up, he will take his chin slightly up and then give his trunk a backward incline, very critical. And from here, he will now start unfolding his elbows by sliding his palms towards his toes, and by bending from his hip joint and stretching from his waist at maximum bend, he will drop his head and rest it on the knees, hook the big toes with his index fingers, and close his eyes and do conscious differential relaxation, wherein he will relax the upper part of the body. Very important, because that will help him go deeper into the asana. His trunk will go down further, his arms will go down further, because gravity then helps, right? So, and he does pran dharana. Now, pran dharana is in pran is breath and dharana is fixation of the mind. And there are 3 types. And as per capacity, it is to be done. One, the first pran dharana pratham is where the sadhak counts the breath in and out. That is 1. He does the counting at the opening of the nostrils. Prandhana Dvitiya is he starts feeling the soft sensation of his breath in the inner walls of the nostrils. And Prandhana Tritiya is wherein he will feel the thermal sensation of his breath on the soft palate. Now, it is advised that once you do the Pashchimtanasana, you also do the complementary practice, which is Supta Vajrasana. I'm sorry, I missed in explaining the releasing of the asana. So the releasing is very different from the other asanas, because here you should first relax, you should unhook and leave your palms close to your ankles, and then just straighten from your hip joint, and your trunk will automatically come up, the hands will slide back, and then of course place the hands by the side of the body, take them behind, rest them, take your neck back, relax, take your legs apart, relax. That steps you already know. Okay. If this is difficult, this asana, of course, given the current circumstances we are in, there are leading practices like Sulabh Pashchimtanasana, wherein if the sadhak is not able to rest his forehead on the knees or not able to hook his toes, he should just relax, leave at maximum bend, leave his head where it is, and rest the palms by the side of his legs. And if this is difficult, he should try doing the Janushirasana, wherein he folds one leg in a way that his sole, the sole of one leg is attached or is close to the inner thighs of the other leg, with the heels close to the inner groin, and the rest of the steps are the same. Hastpadasana and Ekpadhastasana, very interestingly, if you just make the Pashchimtanasana vertical, you would be able to experience Hastpadasana, and the difference between these two is that one leg is taken forward in Ekpadhastasana. Now, having seen this, my dear friends, why don't we do a live demonstration to understand how this asana is done? And Amrita ji has very kindly agreed to be my demonstrator today. So Amrita ji, from your initial relaxation position, could you please open your eyes, straighten your neck, bring both the legs in the center, first the right then the left, bring both the hands by the side of the body, right and left. Now slowly place both the palms on your thighs, close to the groin, that your elbows are close to the body, shoulders bit back, chin parallel to the ground, and spine natural curvature. Now gently take your chin slightly up, and give yourself a slight backward incline. Now, unfolding your elbows, start sliding your palms towards your toes, and then start bending from your hip joint, stretching from your waist at maximum bend. Drop your head to the knees. Let it be a slow, steady, and continuous movement. Then hook your big toes with your index fingers. Rest your elbows on the ground. There is a tendency to stop breathing at this point of time. Please avoid doing that. Close your eyes, relax your upper part of the body, practice conscious differential relaxation, facial muscles relaxed, arms relaxed, your stomach is relaxed, and practice pran dharana tritiya. This can be done for starting for about 8 to 10 breaths. With practice, this can be increased to about 5 minutes also, friends. But if you are able to do more than 5 minutes, ensure you perform the Udyan Bandh and the Ashwini Mudra to avoid constipation. Now, to come out of the asana, please stop practicing Pran Dharana, Amrita ji, and open your eyes, unhook your toes, place your palms close to the ankles, and now simply simply straighten your trunk from your hip joint. Your arms will automatically come back, and then rest your palms by the side of the body, take them back, and relax first the left and the right, then separate the legs, let them relax left and right. Take your head back, close your eyes, and enjoy the positive effects of Pashchimtanasana. Dear friends, there is, for beginner sadhaks, there could be some inadvertent mistakes that might happen. Let's try and correct them right in the beginning. So, Amrita ji, let us show the mistakes. And sometimes while because of competitive feeling, we try to stress our body by hooking the big toes with our index fingers and giving a trunk, a jerky movement to ensure that our forehead touches the knees. Please avoid doing this. Kindly notice the entire purpose of the asana is lost because the neuromuscular coordination is broken. The emotional balance that would have possibly come is not able to happen there. And the muscular tone that would have happened will not happen. So please go for the leading practice if this is difficult. In that position, the final position, sometimes it happens that the knees come off the ground. Please ensure, yes, this shouldn't happen. Let the knees rest on the ground together as one unit, and that will give you the maximum benefit of the asana. And the third one is that when we are going into the asana, instead of bending from the pelvic region, the hip joint, the bend is happening from the shoulders and the upper part of the body. Now this is wrong. The bend should always happen from the hip joint. Okay, thank you so much for this, Amrita ji. Can we quickly also show one leading practice? Yes, for the leading practice, let's do Sulabh Pashchimtanasana. And from your initial relaxation position, again, please open your eyes, straighten your neck. Bring both the legs together, right and left. Bring both the hands by the side of the body, right and left. Place both the palms on your thighs. Your elbows close to the body. Find natural curvature, chin parallel to the ground. Now slightly look up. Take the chin slightly up.
Can you give me one box?
Give your back a slight backward incline, and now start unfolding your elbows and sliding your palms towards the toes. A slow, steady, continuous, beautiful rhythmic movement towards your toes, bending from the hip joint, stretching from the waist. At maximum bend, please drop your head. Do not try to reach the forehead to the knees. Rest your palms wherever they are, close to the legs. This is the final position of Sulabh Pashchimtanasana. Amrita ji, kindly release the asana in the reverse order. And thank you so much for being my beautiful demonstrator today. Thank you so much. Friends, you must already be excited looking at this asana. Why don't we do a group practice? And it will be really nice if all of you practice. And by the time you are laying your mats and getting ready in the initial relaxation position, maybe I spell out the contraindications. For the contraindications, dear friends, very logical. If somebody is pregnant and is recovering from a recent injury, back injury, shouldn't perform this asana, right? And if there is acute pain in the abdomen, or there is acute pain in the back, lumbago, spondylosis, hernia, hydrocele, of course, this asana should be obtained. And even for the initial beginners, for the beginners, a word of caution. We usually have stiff backs, so go slow and steady into the asana. If this is difficult, try the leading practices than trying the standard asana of Pashchimtanasana. Sorry. Okay. So, dear friends, now you're giving me a side pose, all in the initial relaxed positions. From here, and if this is difficult, please try the leading practices. From here, please open your eyes, straighten your neck, bring both the legs together, right and left. Bring both the hands by the side of the body, right and left. Place both the palms on your thighs, pointing the fingers close to your groin, right and left. Now, you see, ensure that your elbows are close to the body. Your chin is parallel to the ground, shoulder bit back, spine natural curvature. Now slightly take your chin up and then give your trunk a slight backward incline. Very nicely being done. And now bending from your hip joint and stretching from the waist, unfolding your elbows, slide your palms towards your toes at maximum bend. Drop your head on the knees and hook your index fingers on with the big toes. Okay, and relax your elbows. Practice conscious differential relaxation. Do Prandharana Tritiya. Very nice, Subhaji, that you're practicing the Sulabh version of the Pashchimtanasana. Very nice. Very nice, Katiji. Shashiji, very nice. Thank you so much for practicing. Okay. Friends, to come out of the asana, stop practicing Prandharana. Open your eyes. Now place your hands back close to the ankles and slide back from your hip joint. Your trunk automatically becomes straight. Hands close to the groin again. Place them by the side of the body, left and right. Sorry. Take your hands back, left and right. Yes. And now take your legs apart, left and right. Relax them. Take your head back or rest it on one of the shoulders. Close your eyes and enjoy the positive effects of Pashchimtanasana. So nice of you to practice this. Very nice. Okay, dear friends. Now that you have, they say the taste of the pudding is in the eating, and you have also tasted Pashchimtanasana now. Let us understand the benefits of the asana. So I think it is pretty much obvious when we saw the physiology and the anatomy chart that the muscular the dorsal muscles get a good stretch, which improves the blood circulation in that area. Then the abdomen part, the anterior part, the abdomen organs and the pelvic organs receive positive pressure, and fresh blood is going into this area. So problems like of the abdomen, the normal problems like constipation, gastric issues can be avoided. The organs function definitely better. Then we also saw that gonad glands are able to absorb the right amount of nutrients, thereby increasing the vitality. So what happens is the seminal weakness in men and the menstruation disorders in women can be overcome. Impotency can be overcome. Then women usually have this periods pain and they're emotionally little down, which is again taken care by this asana. Height of children can be increased with the regular practice of this asana. Belly fat, very important for most of us. Belly fat is reduced with the help of this asana. They say the sadhaks who perform this asana regularly, practice this asana regularly, rarely have issues of the spine like the lumbar pain or lower back pain, etc. And we all know a healthy spine makes us feel much more youthful and vital. Our vitality increase, which are far more efficient. So these are some of the benefits of Pashchimtanasana. I am sure, friends, you have enjoyed understanding how this asana is being done. So what we did today was we understood the interpretation of the asana.
20 minutes over. 20 minutes over.
Charts. We understood with the help of the chart, we understood the anatomy and the physiology of the impact on the our body. with the help of the chart, we also understood the how the asana is performed, the stages of the asana, how to release the asana. We saw the leading practices. We also saw the complementary practice, which if done together will give optimal benefits to the sadhak. Then we understood we saw a live demonstration by Amrita ji, and you all have been very nice and cooperative and enthusiastic to do the group practice also. We understood the contraindications and also understood the benefits of the asana. I am sure that you yourself are enthusiastic in kind of taking up or integrating this asana in your routine yoga abhyas. Please do so, because this helps us get a healthy body and mind. My best wishes to all of you. Thank you so much. Best wishes. Okay, namaskar.